Now you're going to have a catheter in for at least a week, okay? That will be put in during your surgery, so you'll wake up with a catheter in place.
Right.
So you need to learn how to look after it at home, how to empty the bag.
Yes.
So the staff at St Andrews will make sure you're happy with emptying it before they let you go home, but I'm going to show you how it actually works. So this is the catheter, this bit here. So this bit will be in your bladder. There's 2 drainage holes. The urine drains down here and into the bag, which will be on your leg. This has a little balloon on the end that's in your bladder so that it won't fall out. So your doctor will do all of this in surgery. He will put sterile water in there, about 15 mils. I'm going to show you with just 10 mils of air so you can see what it looks like. Okay, so that will be inside your bladder. That acts like a cork, it won't fall out.
Oh, that's
Okay.
I understand, yes.
Yeah, so when you come and see us a week after your surgery, we'll take that catheter out. We get a syringe, one of us nurses, put the syringe in there, the water comes out, we make sure it's all empty, and then we get you to take a breath in, and as you breathe out, we slide it out.
Does that hurt?
No, it doesn't hurt. It feels strange, a little bit weird, and it only takes a couple of seconds to come out, so you've really just got time to go, and it's gone.
Oh, I see.
Okay, this is what you'll need to be doing at home, is looking after the drainage bag. It's got a few straps on it that keep it in place. This one goes up around your thigh. Okay, and then the catheter's secured in here. That will stop it pulling. And then down here is your leg bag. Again, with more Velcro straps. Now these straps come very long. You can trim off the end if it's getting in the way. There'll be another strap down here. Okay, so you're going to need to empty this bag during the day.
Yes.
It does hold 500 mils. You probably want to empty it a bit before that, it'll get too heavy.
Sure.
So this little tap down here, you can go into the toilet, put your foot up on the edge of the toilet, click the tap down and drain it into the toilet.
Yes, I understand that.
Yep, turn the tap off, away you go again.
That's quite simple.
Now at night time, you will fill that bag up too quickly.
Yes.
This holds about 500 mils.
Yes.
So, again, St Andrews will show you how to put on a night bag, which holds 2 litres. So when you're ready to go to bed, you get your big bag, pull the cap off. Sometimes they are quite tight, you might need to pull it off fairly firmly. Plug this in down the bottom, turn your tap on, and that will drain through into the overnight bag.
I understand.
Okay.
Yes.
Put that in a bucket or something by the side of the bed so that you don't step on it and pull it apart when you're getting out in the morning. And then in the morning, turn your tap off, very important. Unplug it. Now the night bags are single use,
Yes.
so you'll need to cut that with a pair of scissors and empty it in the toilet and then throw it out.
Sure.
St Andrews will send you home with a good supply of these to last you for at least a week. Now you can shower with your catheter in.
Yes.
You may find the straps get wet, so if there's anyone in your house with a hairdryer, you can borrow that and dry it off.
There's only one thing, I sleep on the other side of the bed. Can I change that to
You
my other
can,
leg?
yes. Feel free to move that, all right? You can put that on whichever leg is comfortable.
Right.
Move this up and down so that it's comfy as well.
Yes.
You can adjust it yourself.
And if I have any problems, I can always
You give
phone
us a
you.
call.
Yes.
Yeah. While your catheter's in, you do need to make sure you're drinking adequately.
Yes.
Okay, so adequately I mean at least 2 litres of fluid a day. You need to drink enough to keep your urine a fairly clear colour. By enough I mean at least 2 litres a day.
Yes. Yeah, that's a lot of water. I don't normally drink that much.
You'll be able to see the colour of it in the catheter tube. It may be a little bit pink to start with. That usually settles very quickly. But occasionally you can still see little flecks of blood coming through. There may be little clots. It may get a little bit pink sometimes, particularly after you've used your bowels, when you've been straining. Drink plenty of water, that should clear again fairly quickly.
Yes.
If you find it's getting really red colour, or if there's big clots in there, or if the catheter's not draining continuously, you do need to give us a call. We don't want your catheter to get blocked. It doesn't happen very often, but you need to ring us if you're worried about it.
And so what would I experience if the catheter is blocked?
You'll know if your catheter's blocked. You'll either get pain in your tummy because your bladder's getting full, or if there hasn't been a consistent flow of urine into the catheter bag. It should be draining continuously, and if you've been drinking enough, you should have a continual flow. So if there's no urine going into the bag, or if you feel like your bladder is filling up, you do need to give us a call.